Okay, good morning, everybody. Hi, welcome to the role of direct primary care in improving health and reducing healthcare costs. My name is Allison Velez, and I'm joined by Dr. Barker this morning. We'll start by doing some brief introductions. Dr. Barker, my colleague, and I will be talking about the role of direct primary care today, and we're excited to speak with all of you and to hear some of your questions. So we'll start with just some brief introductions. My name is Allison Velez. I oversee HR, talent strategy, health and wellness strategy for Everside Health, headquartered in Denver, Colorado. I do have over 20 years of HR experience, and 10 of those actually supporting healthcare organizations. I've had various roles in HR in healthcare, as I said, most recently before Everside Health at Optum Care, prior to that, DaVita Medical Group and DaVita. I do live in Colorado with my lovely family, and I'm really pleased today to be partnering with one of my closest colleagues at Everside Health, Dr. Barker. And so Dr. Barker, I'll turn it over to you to do your introduction as well.
Thanks, Allison. Nice to meet everyone virtually. I joined Everside a little over 2 years ago. Before that was the Chief Medical Officer for CVS Minute Clinic, which is a chain of about 1,100 retail health centers located in CVS stores. When I joined Everside, we were just some 40 clinics or so. And we've grown to over 350 clinics in the past 2+ years, all helping companies to provide comprehensive healthcare to their employees in a way that improves the employee's health and decreases the healthcare spend that's seen by these self-insured businesses. So Allison and I are super excited to kind of walk you through a little more. You've probably heard the term direct primary care, and happy to walk you through more of kind of what that means.
Okay, perfect. Thanks, Dr. Barker. So as we learn a little bit more about direct primary care and the role that it can play in your organization, we do want to just start by talking about what are some of the kind of high level obstacles and opportunities. So you'll hear about that in just a moment. You'll hear more about, as Dr. Barker said, what is direct primary care? This will be a great education session about the role that it can play in your health strategy. It is a flexible approach, a holistic approach, and definitely is an employee-centric approach that we love to taking care of employees. And then we'll talk a little bit about how the impact of COVID has really affected employee needs, and how direct primary care can help address some of those problems. And as I said earlier, we're really excited to be able to answer some questions as we go live or throughout the session as well. So please be sure to enter your questions in the chat. Okay, so with that, let's go ahead and take a look and discuss what some of the obstacles and opportunities are that as HR leaders, as benefit leaders, as talent strategy leaders, some of the things I know that we all have been facing over the past year as our employee needs have really evolved. I think there's kind of 5 key points here that really stand out to me around how employee needs have evolved. And I think first and foremost is everybody's really focused on staying healthy and well. And so there's been a greater need and emphasis for employers to focus on employee health and wellness. In addition to that, we've seen a lot of transitions, I'm sure you have too, in what we think of as wellness. And in particular, one of the most notable areas of change over the past year has been the increased need for mental health support as part of the overall health and wellness strategy. It's continued to be important more than ever that employers are really providing competitive, affordable benefits to their employees. And in particular, as employees have become more mobile with virtual work and their employment options have expanded, more and more employees are really looking for competitive health and wellness benefits as part of the employment package when they're making decisions. So talent retention, standing out as an employer, these health benefits are playing an ever increasing role as part of that package that we're really offering prospective candidates. And then related to that, we're just seeing an increase. I know many of you are as well, in that employees, prospective candidates are really thinking about this as a more and more competitive part of their non-salary benefits as they're considering employment opportunities. So while there have been obstacles and the needs have really evolved over the past year, we're seeing that really transform into a number of critical opportunities for how employers think about their health and wellness strategy and what they're offering to their employee population. So let's actually transition a little bit and talk about, how have the benefits packages fared in today's climate? And, I think, most of us know now as HR leaders, benefits leaders, that HR benefits planning has really transformed over the past year. We've gone from an annual renewal process to adding and tweaking our deductibles and other healthcare offerings to try to manage costs, to it being a much more strategic part of our employment proposition. Additionally, it's become a really big change management effort. And so I think at this point in time, many of us are dealing with considerations and planning and strategies for health and wellness on a daily basis versus what perhaps was an annual process in the past. Certainly, fee-for-service healthcare really has been an option that many of us still are familiar with, perhaps, but it isn't a healthcare option that really is prioritizing volume over quality. And if anything has evolved over the past year, we know that quality healthcare, making sure that we're being really attentive to an employee's overall well-being, has become really critically important. Additionally, fragmented benefits really have created piecemeal results, and I'll show you in just a moment. Before we go here, I'll show you in just a moment what that fragmentation has resulted in. But fragmented benefits have been a real opportunity, but mostly a challenge as employers are trying to figure out how to bring a holistic package of wellness to their employees. And then last, EAP programs, which many of us have traditionally relied upon to help address issues around mental health, substance abuse, and other needs that our employees may have really fallen short of really meeting that true need, especially over the complexities that we've experienced over the past year. So while all of this has made your life perhaps more difficult, it also has really created a number of opportunities for employers. And one of the things that I am really celebrating right now is the fact that health and wellness is becoming part of the corporate culture. It's part of the corporate dialogue to ensure that we really are focused on what our teammates and employees' needs are on a day-to-day basis and keeping them healthy and well. So as I talked about just a moment ago, let's take a look at how that fragmentation in the healthcare benefits place has really created some complexity. There are a number of piecemeal offerings that are available to HR leaders, to benefits leaders, and frankly, it has become quite daunting and complex to navigate this space. So there's a couple things that we think is really important here to note, is that while there are a number of offerings available, it has become even more complicated to make some of the decisions about partnerships and programs to bring to the table. And even more importantly, as an HR leader, I know most of us are really thinking about how do we simplify the message, simplify the offering for our employees so that they have the greatest ability to have access to the care that they need. And so in this environment where there are many piecemeal opportunities and programs and organizations, one of the things that we're really seeing companies struggle with is the lack of coordination between those programs and the overall health strategy. It also is leading to duplication of effort. And so as I transition here in just a moment to Dr. Barker to really talk about what direct primary care is, one of the things that you'll hear is really how some of these obstacles can be overcome through direct primary care for your employees. Before I transition to Dr. Barker, I do want to take a quick poll and would love to get your feedback. And the question I'd love to ask you is, what is the greatest obstacle you are trying to overcome when it comes to offering healthcare benefits to your employees? So let's take a look at the poll. There are 5 answers that you can choose from in another category. So the first is about staying competitive. The next is low employee satisfaction with healthcare benefits, perhaps a lack of engagement. Number 4, limited understanding on how you can lower the employee healthcare costs for your organization. And then perhaps the 5th option that you could select from is just dealing with the fragmentation and the multiple options available in the marketplace. So which of these or other, if it's none of those, is your biggest obstacle that you are trying to overcome when it comes to healthcare benefits? We'll give you just a moment to enter your response. And team, I'll have you, when you feel like we have enough responses in and we can show the responses, I'll let you queue that up. Okay, let's take a look at how the audience has responded. So first and foremost, at 52% of our participants, staying competitive with your healthcare benefits offering, and in particular because of increasing costs, stood out far and away. So appreciate those responses. It looks like everything here is represented to some degree or not. There are many obstacles and challenges that we're facing today. And so with that, I would love to turn this over to my partner, Dr. Barker, who will be talking about how direct primary care can help address some of those obstacles that you may be facing. Dr. Barker?
Thanks, Allison. Let's head over to the first slide here, direct primary care. So, we talked a little about direct primary care. These next few slides will go into much more detail. When you have a direct primary care partner, you really are setting up a strategy to provide comprehensive clinical care to your employees, either on site, which is literally at the work site, or near site, which is usually somewhere in the community that's convenient for both the employees, and in many cases, their dependents will become part of this plan. In both cases, the result is shortening commute times, meaning less time away from work and more time receiving care. Now, importantly, the care provided by your direct primary care partners is value-based care. This is probably the most important part of direct primary care. So it's not fee-for-service. In a fee-for-service world, which, by the way, most of the world is in, there's a real misalignment of incentives. So providers are only paid when a patient shows up to be seen, usually because they're sick or have some other problem. But your employees want to be healthy. The employer wants the employees to be healthy, as it reduces costs and leads to a happier workforce. So in a fee-for-service world, providers are paid not to keep you healthy, but by how many visits the sick patients have, by how many tests are ordered, by how many procedures are done, et cetera. Value-based care, on the other hand, is paid a flat fee to keep your employees healthy using whatever means are necessary. So patients have unlimited access to care. And we also have, direct primary care partners also have advanced analytics that allow the providers to reach out specifically to those employees who are most likely to have costly healthcare events and to be able to see them and talk with them before they become ill. So DPC is not insurance. It works alongside insurance. And while it provides the full scope of clinical care, it does emphasize prevention, again, in contrast to traditional fee-for-service that is often reactive and used only when it's too late and the employees find themselves in the urgent care center or the emergency room or at a specialist office. The partnership is with a flat fee per member, usually a per member per month fee that makes the benefit manageable, makes it easier to see a return on investment, makes it easier to see the savings that are passed on to the employees and easier to see the employer's clinical costs decrease over time. It also emphasizes working closely with the employer. We oftentimes do things like modifying the benefit plan to take full advantage of the partnership in order to maximize the health of the employees and reduce medical claims costs. It is flexible in adding ancillary services. You saw the slide that Allison showed earlier. So many different partners in this space, the healthcare space, each one doing a tiny bit of, just diabetic care or just virtual behavioral health. And so, to be able to add on ancillary services without requiring multiple vendors limits both the fractionation of care. It also limits the chances that you might be double paying for certain services. So really useful for things like wellness or mental health or nutrition to add on to the primary care. Next slide. So this is showing some of the ways that this model leads to successful outcomes. One is simply better access to care. Care when the patient needs it at times and locations that are convenient to them. DPC visits last as long as 90 minutes. So, consider that the next time you go in for the average 10-minute PCP appointment. And you really need these long visits to fully get to know the patient, fully address every concern the patient has. It's a very common statement in our clinics that the patient will come out and say, they just kept saying, what else, what else, what else? And I kept telling them every single thing I could think of until I had no more, like every single thing I could think of had been addressed. And you need that time to really be able to set up the treatment plans that are going to work for that patient's particular lifestyle and environment. Access also means instant messaging. It means video chats, group sessions, same-day appointments. Really, whatever modality works for the patient at whatever hour works for the patient. That's how you're really going to impact their healthcare, is really just access, to be there for them. Another hallmark of the model is the approach to population health. Remember that direct primary care providers are incentivized to keep the entire population healthy, not by the number of visits. As a result, you need sophisticated analytic modeling that can tell each provider each day which of their patients is due for a mammogram, which of their patients is most likely to end up hospitalized in the next 3 months, using a variety of health risk assessment data. It's this type of data that leads to the personalized touch points and reach outs that keep every employee healthy, whether or not they happen to have an appointment that day or that week. So the combination of better access to care and the technical ability to segment the employees so that they're each receiving the messages and care they need to stay healthy. So for example, you wouldn't send the same message to someone who's on no meds and has no medical problems. Those messages would be more around making sure they know that we're here for them if they need care. It's about staying healthy. There'll be a different set of messages, different sort of care plan that you would have for an employee that's on 5 medications. So being able to have a really sophisticated way to segment the population and give each segment the care they need invariably leads to lower healthcare costs because you have healthier employees, and that's good for the employee. It's good for the employer. Next slide. So if the typical primary care, if just typical primary care was delivered in a value-based model tied to health versus tied to the volume of sick visits, that would be valuable. But it's worth noting that direct primary care is really more than just typical primary care. It's everything you would normally think of as primary care, but on steroids essentially. So going counterclockwise here, it does mean full primary care from birth to geriatrics. It means specialized condition management, programs around things like diabetes and hypertension, along with the analytics to know exactly which patients need to be targeted for those programs. It means acute procedures that most primary care providers would send to more costly urgent care or emergency room sites. Think of things like suturing a laceration or x-raying and splinting a fractured arm. These are things that most providers learn how to do in their training, but the fee-for-service model that just limits them on how much time they can have and what they're allowed to do just doesn't allow them to do this. So it means, at the bottom there, it means screening for and initiating treatment for costly behavioral health conditions like depression and anxiety. In fact, on that point, many of our DPC clients have an embedded psychologist as part of the team to ensure the coordination and best practice around behavioral health issues without needing the fractionated, more costly solution of sending the patients out to the community for these services, where oftentimes there's just not in sync with the medical provider who's oftentimes prescribing the medications. Having that coordination between the talk therapy and the medication is really important. On the other side, down at kind of the 5 o'clock, labs are drawn on site, vaccines are given on site. Importantly, the health centers stock over 50 of the most commonly prescribed medications. So employees do not need to find time to go to a pharmacy to start those medications that they need to stay healthy. And finally, the social determinants of health is increasingly being recognized as being as important or even more important than the clinical care received. Go to the next slide. You can see one of the many recent data breakdowns of this. So, things like housing insecurities or not having the resources to buy the foods necessary to follow the diet that was laid out by the care team is an often overlooked part of keeping your employees healthy. You can see on this chart, like those sort of social and environmental conditions that you live in actually plays a larger role in your overall health than the actual healthcare and the medications that you may receive and the treatment plans you may receive. So really important. And so we partner with the nation's largest aggregator of community resources. So we can help any employee who's looking for help with things like transportation or having the access to the internet or food or housing. And again, the goal of the DPC partner is to keep the workforce healthy, whatever it takes. There's no billing code. A fee-for-service practice wouldn't really know what to do with social determinants of health. There's not a mechanism for being reimbursed for this sort of important holistic care that is what is needed to keep the your employees healthy. So really important, social determinants of health. Next slide. This is an example of how a good healthcare partner would work with you and evolve to your needs around, in this case, the recent pandemic. So when things first started, when the COVID pandemic first started, we kind of switched gears. Everyone kind of switched gears, but we switched gears for our employers, and our time was spent rank ordering all of the employees for who would be most likely to have a bad outcome if they should contract COVID. And this, the diseases that were thought to put you at risk were just released by the CDC. We immediately rank ordered all of our patients in terms of who is most at risk. And then our providers reached out to all of the at-risk employees and made sure that they had enough medications that they needed to stay healthy, to make sure they understood the just released recommendations on how you stay safe. From there, we started partnering with employers on how to get back to work safely, using an app we developed just for our employer partners to start screening employees to return to work and to virtually follow up with those employees who screened positive. And this was followed, as soon as COVID testing was introduced, we started introducing COVID testing into the clinics and working with return to work strategies with our clients and how to get the employees safely back to work. We started, as soon as vaccines became available, we were partnering with local departments of health and with each employer to segment their employees to make sure that the most at-risk people were being vaccinated first. Interestingly, some of our time currently, I don't think it's even on this slide, some of our time currently is spent on developing materials to help our employer partners reduce vaccine hesitancy within their workforce, to assure that as many employees as possible can be vaccinated against this deadly virus. So it's a good example of how the goal is to keep the population healthy. The goal is to keep all of the employees healthy. And that can take a variety of different directions depending on what is happening. And so that was a good example of how having a healthcare partner to think through these things is really valuable. I am now going to turn it back over to Allison. Thanks, Allison.
Thank you, Dr. Barker. So I think what a great summary and overview of direct primary care and some of the benefits that it can bring to employers. As I was listening to Dr. Barker, I was just reminded about how much complexity we have had from an HR point of view around helping our employees through the pandemic. And there are a few summary points to make, I think, about how direct primary care has been impacted, but also how it has created value through the transition of working through the pandemic in the various stages. So one of the things that we really have seen as a really significant change is the need for virtual and outreach benefits. So as Dr. Barker said, he talked about how we have really helped employers be able to identify, not personally by name, because obviously we want to make sure that we're ensuring privacy for folks, but that our providers on behalf of the employees were able to do outreach with potentially high-risk employees to help make sure that they were really getting the care and the attention that they needed to keep them safe, healthy, and well. But along with that, one of the big opportunities that has been created is really the increased utilization of virtual care. And a direct primary care partner can really help support the virtual and remote needs of healthcare that your employees may have during this time. We've seen something that became a necessary source for healthcare during the pandemic really evolved to, in many ways, some of the typical and standard ways that employees like to access care at this point. It's convenient. People can do it without a huge time effort and have that direct access to their provider. So virtual has certainly been something that we've seen evolve over this time. Additionally, certainly, I think the ideas about what constitutes health and wellness have significantly evolved over this time. There is a very large emphasis on things like mental health support and increased focus on people staying well in a proactive way. So an emphasis on things like diet, exercise, and even things like meditation that are supportive of mental wellness. And then last, one of the additional ways that the DPC model has been impacted is really through our ability and our focus on managing chronic conditions for better long-term health. And I do think Dr. Barker talked about this really well. We're identifying providers being able to identify at-risk patients that need special care and attention and proactive health care is certainly a huge benefit of direct primary care in taking care of the employee population. It is overall, direct primary care has afforded a really simple, holistic, accessible way for employers to take care of their employees during a really complex and challenging time. So let's talk a little bit here. I think we've got perhaps another, on the next slide, we've got another poll for you to respond to. And that is, what is the biggest challenge you anticipate for your employees in 2022 related to healthcare benefits? So just 3 choices here. The first is really around ensuring that your health and benefits are competitive to help support employee acquisition or recruitment, as well as retention. The second one is really responding to the increasing demands for healthcare benefit options, such as mental health and virtual care. And then last are just increasing demands for technology-enabled tools to help employees manage their healthcare benefits. So that might be apps and other tools that are available. So I'd love to hear your feedback. Which one of these 3, or perhaps something different, are you anticipating as a key opportunity and challenge for 2022? Okay, and the responses are in. So what we're seeing here is 64% of responses are indicating that keeping the healthcare benefits competitive to help support retention and employee recruitment is at the top of the list of challenges for 2022. Certainly, I know I see that and feel that as well. And I think direct primary care is potentially a great option to help make sure that the benefits package remains very competitive. So thank you for your responses to the polling question. As we get ready to turn the session over for questions, I would like to talk about, just in summary, some of the direct primary care benefits that employers are experiencing. And going back to earlier part of our session, we talked about how the fee-for-service model is really prioritizing volume, quick appointment times. And one of the things that we know, and you heard about from Dr. Barker, is that direct primary care does allow for better access, longer appointment times, same-day availability, which we know can lead to improved health outcomes and savings for employers. Also, of course, with incredible benefits to the health and wellness of employees. The second is, and going back to the visual about all the fragmented health offerings that are available today to employers, one of the things that direct primary care does is it really simplifies and brings a holistic lens to the healthcare package and offering with an all-in-one benefit solution. It can be customized to allow for access to mental health care, to virtual care, and to other needs that employers are feeling and seeing today, but without the multi-vendor juggling that comes with the fragmented approach. And then certainly last but not least at all, direct primary care is a great way that benefit managers, HR leaders can really advocate for their employees with the best in class solutions in order to take care of some of those additional healthcare challenges and needs that employees are facing today. So again, whether that's mental health, access to smoking cessation, other programs that traditionally are supported through EAP, direct primary care really is a more robust solution that brings all of those pieces together for employers and for employees. So thank you for joining us today to learn a little bit more about direct primary care. Dr. Barker and I would love to take some questions and talk a little bit more about how direct primary care works. And so we'll open up the floor for questions at this time. And Amanda, I don't know if there's a reminder about how folks can ask questions.
Yeah, absolutely. Down at the bottom in your webinar controls, there is a Q&A button, also a chat button if you just have some general comments or anything like that.
Perfect.
So, Dr. Barker, I think this is a question that you can probably answer. The question is, how do DPC providers improve health outcomes better or more so than traditional providers?
Yeah, thanks for the question. It's not necessarily that the providers are necessarily any better or worse. I think it's the system that they have to work within is better, or in the fee-for-service world, kind of worse. So if you take, sometimes things work best with an example. So I'll give you the example of something that happened in one of our work sites. Patient came in, they had cut their finger, it required a couple of sutures. In the fee-for-service world, that the provider has 10 minutes. There's no way they're going to suture anyway, so they send the patient to the urgent care center. And it seems as though, job well done. In this case, because we have so much time, because we have the abilities to do things that the patients need to have done, while we were suturing the patient, we had extra time to talk to them about other things, because we saw that we had a comprehensive view of their health, that they hadn't had a colonoscopy done and they were over the age of 50. it gave us the extra, we had kind of a captured audience because he had to sit there and get his fingers sutured. So we were able to talk to him of all the benefits of why you should get a colonoscopy. He actually, because of that, went to get a colonoscopy, and they found a very low grade cancer. And because it was captured so early, it was very easily resected. And one can imagine the cost and discomfort if the patient had progressed a couple more years and needed chemotherapy, needed surgery. So this is an example of how when you build a system to give more time, more analytics, a better view of the patient and be able to give each patient the care they need, you're able to address a lot of problems before they become problems and keep the workforce healthy. So again, I think it's just a better system, more aligned around keeping everyone healthy versus just being available for when they're sick, which they also are. But that would be my answer to that.
Okay, great. Since I think this next one probably, Dr. Barker, you can also take. It says, does a direct primary care model make sense for an employee base who doesn't often go to the doctor?
Okay. Yeah, so that's an interesting question too, because there must be a reason why the employee base does not often go to the doctor. Either there's low engagement. These are either people that could benefit from going to a provider, but they don't have the incentivization or they're just not engaged enough to be able to go. And that's an important part of what we do. The important part of what direct primary care does is engagement, is getting those employees that don't often go to the doctor in, so that we can help them and help take care of things before they become problems. Now, the other population is maybe they don't go because they're completely healthy. Again, that's a transient state. People are only completely healthy for so many years. And to be able to get them with good, healthy habits, to be able to let them know, even if they're completely healthy, hey, if you wake up with pink eye, if you wake up and you're playing basketball and you've sprained your ankle and you're completely healthy, but now you're going to go to somewhere, don't go to the urgent care center, don't go to the emergency room, come to the health center, the employer-based health center, where we can take care of you in a way that doesn't lead to fractionation of care and leads to lower costs overall. So I would say whether you were truly healthy or whether you're not healthy and just don't often go to the doctor, it makes sense to partner with someone as an employer to get everyone engaged in their own care. Is always a positive. And for those employers that have a direct primary care partner, invariably, when the employees are asked, has this service made you feel any different about your employer? It's always positive. It's always sticky for the employer to be able to have this sort of offering for their employees.
Okay, thanks, Dr. Barker. Allison, these next few I think are probably best for you to answer. This one says, how does DPC fit into or work with all of the other healthcare vendors that we work with as part of our benefits offering?
Okay, thank you. Yes, happy to jump in on that. So I think one of the things that we see is that direct primary care can actually really, as Dr. Barker said earlier, it sits alongside your insurance program. As far as working with other vendors and resources, we talked about the fragmented approach, and in many ways, direct primary care can replace some of those other fragmented vendors that employers may be partnering with today. One of the things that I think a great direct primary care partner will do is really work with the employer, the benefits manager, and HR leaders to ensure that they understand the full range of what is available to that employee population as well, in terms of internal programs or other resources that employer has deployed, so that the provider can have a comprehensive understanding of what is available to each employee. So I would really think of direct primary care as, in some ways, the glue that brings all of those different offerings together in a comprehensive and holistic way to the employees, so that it can be simplified understood and really easily accessed.
Okay, thank you, Allison. This next one, probably both of you could answer it from different perspectives, but the question reads, what kind of engagement do you usually see with employees who have direct primary care as a benefit or a service as part of their benefits package?
The data that I've seen is always very satisfying, and that is that you have a certain uptick in employees that didn't really feel like they had a PCP or a medical home, and that happens very quickly. But then you see this continued growth because those employees that do have a primary care provider out in the community, they inevitably end up using the health center for something, and sometimes it's something very small, a very small, a cough, or they need to go in for biometrics or whatever it is. But they find that the experience kind of wins them over. The experience and the providers and the team and the follow-up and the sophistication of the care. And so you'll find that over time, month by month, more and more people join on to have this health center be their primary care home. There's nothing forcing them to. It just happens naturally over time. There's better access. It's a better experience. And so that's what I've seen. Allison, anything to add to that?
I think maybe just to add on to it, but maybe to take a different look at the same question. One of the things I think we think about when we think about engagement is certainly engagement with the provider, engagement with healthcare, but there's also how employees feel about their employer as part of the assessment of engagement. And one of the things I love to hear about, for organizations that are using a direct primary care partner, is that we hear these stories about how employees will say, this is the best benefit that my employer provides to me and to my family. And we also hear about, many people who say it's a really important part of the reason they stay with their employer is really to help them ensure that they have the right type of healthcare, that it's accessible, that it's easy, and that it's comprehensive. And so when I think about engagement, I also think about it as engagement with the employer. And we do know that time and time again, employees are really saying that this is an important part of feeling engaged, connected, and staying with their current employer as well.
Okay, thank you both. Looks like we have two more questions here. So Allison, this next one, I think you're well suited to answer, but the question is, as an HR leader, how does direct primary care make my life easier?
I love that question. There's a number of ways, and I think it goes beyond some of what we've already talked about today, sort of, bringing fragmented benefits together, making sure that we're being proactive about people's health and wellness. But from an employer's point of view and a benefit leader's point of view, what it does is it really creates an opportunity to have a trusted partner. And that trusted partner can help work on a variety of solutions and needs that an organization has. And whether it's really driving down specific claims costs in certain areas. So that is, we all know, if you run benefits or HR, you might be trying to reduce ER visits or urgent care visits, or perhaps you're trying to address, a population issue that you might have with your employees around hypertension or diabetes management. And so a great direct primary care partner will help really solve jointly those types of opportunities and challenges that employer might face. But one of the things I think that's very noteworthy is that employers who work with direct primary care also have a partner on how to communicate and how to engage the employee into their own health and wellness journey. And so whether it's reminders about how to access a provider, how to use a virtual care or other technology to get the help that's required for an employee, or simply just to remind people about having their annual wellness exam. As Dr. Barker shared so many examples of catching problems early so that we can keep people healthy and well, and address problems before they become larger problems for employees. So again, it's really about a partnership and about holistic care, making sure that employees have access to the providers when and how they need them, and ensuring that employers have a way to really message and articulate their health and wellness strategy to their employee population.
Thanks, Allison. And actually, this last question I saw, I think we already covered. So I think that wraps up our questions for the live session portion.
Thanks for all the
Great.
questions.
Thank you. Yes, great questions.
All right, thank you both. And we'd like to thank our sponsor, Everside Health, and our presenters, Dr. Tobias Barker and Allison Velez, for presenting this very informative webcast today. And thank you to everyone for attending. Your feedback is important. Please take a moment to fill out the exit survey that opens in a new browser page on your computer. You do have a few minutes before the next webcast begins, so you can visit the exhibit hall or grab a fresh cup of coffee or whatever your beverage of choice may be. We will be sending you an email with the credit information. You can also find your credits on the View My Credits page of your membership profile once this webcast has been archived. This will conclude our webcast session. We hope you've been enjoying Inspire 2021. All the virtual booths are available for the entire event, as well as the networking lounge. So take some time to look around and connect. Have a great day, everybody.
Goodbye.
Thank you.